medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
I want to talk this time about a drug that's had so much publicity, but unfortunately not in the right context, in my opinion. I'm Dr. Mitch Ghen. I'm here to talk to you today about ivermectin. Now, this was identified in the 1970s, but it was made into a medication by two gentlemen, Camper and Satoshi, who, by the way, were awarded the Nobel Peace Prize in 2015. Now, typically, of course, it's an anti-parasitic, anti-scabies, strongyloides, pedunculosis pubis. However, it does inhibit viral replication. It's been shown in article after article. It's often through basically hypoxia-inducible factor, and it blocks both RNA and DNA viruses, especially envelope viruses. Therefore, the effectiveness is also suggested for many other viruses, by the way, dengue fever, yellow fever, Zika virus, chikungunya, which I've had the privilege of treating several cases of very successfully, thank God, West Nile virus, HIV type 1, and of course, a coronavirus type 2 as well. Now, in addition to its antiviral properties, I use ivermectin often in cancer because it's an amazing additive. And it blocks the pathways, the catechin-Wnt pathways, to disrupt the cancer stem cell production, which you hopefully know is what leads to metastasis. Its unbelievable safety profile should add to the reason to use this drug more often. 4 billion doses given over the last 15 or 20 years, with a remarkable, amazing addition in clinicians' armamentarium, with really almost no deaths too that I know that have been reported, basically safer than any of the typical aspirin or Tylenols that we write as clinicians. So a parasitic, antiviral, anti-neoplastic, cheap drug that can also be compounded, by the way, is something I encourage you to read about more often and make ivermectin part of your armamentarium, especially because it has so much to offer you in the way of helping so many different patients.